Good evening, esteemed members, Dr. Nasil Sakir and Dr. Sangeeta Saji, and to the one and all present here for the webinar today. I am truly honored to have been invited to this webinar today, and I'm really grateful for the chance to share my experience of M Endo preparation classes, which was conducted by Dr. Nasil and Dr. Sangeeta. And I'm here before you today with a heart full of gratitude and appreciation to the two extraordinary individuals who have played a vital role in my academic journey. As mentors, you both have gone above and beyond to clear all my queries and confusions regarding the exam preparations. And I'm truly honored to have had the privilege of learning under your guidance. And I wish all the new aspirants who want to take up this examination and the training under your guidance a great success. Now, a few words about the authors for the speakers for today webinar. Dr. Nasil Sakir. He completed his graduation from the University of Kerala in 2008 and post-graduation in conservative dentistry and endodontics from the Rajiv Gandhi University of Health Sciences, Bangalore in 2013. He has also completed the postgraduate certificate in oral implantology, his postgraduate diploma in clinical research, and his membership of Faculty of Dental Surgery, that is MFDS RCS, from the Royal College of England, and membership in Endodontics, that is M Endo RCS, from the prestigious Royal College of Surgeons of Edinburgh. Currently, he's working as a specialist in endodontics at the Medical City for Military and Security Services, Muscat, Oman. And the second speaker for today is Dr. Sangeeta Saji. She completed her graduation in 2015 from PMS Dental College, Trivandrum, and completed her post-graduation from Assisia Dental College, Kollam, in the year 2020. She cleared membership examination in endodontics from the Royal College of Surgeons of Edinburgh in 2022, and her MFDS from the Royal College of England in 2023. Currently, she is working as a senior lecturer in Assisia Dental College and is a consultant endodontist in Dr. Koshi's multi-specialty dental clinic and other clinics in and around Trivandrum. I welcome both of you to the webinar today, and I request you to take on the show from here and enlighten the participants present here. Welcome, doctors.
Thank you so much,
Thank
Dr.
you,
Roshan.
Doctor.
Welcome.
Good evening, dear doctors. Welcome all of you to this webinar on membership in endodontics, Royal College examination, all you need to know. So I would request all the doctors to kindly keep your audio on mute, and so that there's no disturbance during the webinar. And at the end of the webinar, we'll have a Q&A session where you can clarify all your queries. So today, these are the things that we intend to discuss. Starting with why MEndoRCS? What are the benefits of doing this exam or clearing this degree? Okay. Now, which Royal College? So there are multiple Royal Colleges. So which Royal College do I choose? Okay. What is the eligibility criteria? How is the process of application? Okay. And then we will discuss about the exam format, how to prepare for MEndo, and finally we'll have a Q&A session. Okay. Am I audible? Is it clear?
Yes, you're audible, Doctor.
Okay, fine. Okay, so first of all, what are the benefits of having an MEndo RCS? Okay, each and every person might have their own reasons for choosing this exam. Okay, so most of you who are attending this webinar here, you're attending this mainly because you are somehow interested in giving this exam. Okay, so everybody have their own reasons. So for me, if I tell you, my main motivation was, the masters which I have done in India. It is a master's in conservative dentistry and endodontics. Okay, so most of you would be aware that many countries now are starting to not accept this because it's like a dual specialty. Okay, so whereas in Western countries they have an exclusive endodontic training program. Okay, it's a master's or MClint, and it's purely a 3-year or 4-year endodontic training program. Whereas in India we are doing it's like conservative dentistry and endodontics. So So for me, I wanted to do a degree which would give an edge over others and definitely prove our caliber in the field of endodontics. Okay, so that is the main reason why I started this journey. But if you ask me, the most important reason for doing this exam or preparing for this exam would be to enhance your knowledge and clinical skills. Okay, so this according to me is the most important thing, and I keep telling this in most of our sessions. Okay, now as endodontist, we are very less aware of other restorative dentistry subjects, including perio and prosto. Whereas when you prepare for this exam, even though we call it as an M Endo RCS exam, it's equally involving the other restorative specialties. Okay, even the topics which are tested in the theory or even in the oral examinations include endo, perio, and prosto topics. Okay, so definitely you'll get to learn a lot of new things, and it opens up an entirely new perspective towards seeing a patient and towards assessing a clinical case. And definitely you get an international recognition as an endodontist. Okay, so this degree is very well accepted in several countries, and you start getting better job opportunities. And for those of you would like to know, this is basically an endpoint exam for specialty training in the UK. Okay, so basically in UK, whether they are doing an MClindent or an MSc, at the end of the 3-year period, they have to give this exam as the final exam before they graduate from the college. Okay, so for us as foreign trained dentists, what benefit we have is, if at all we have a plan to migrate to the UK, if you clear this M Endo RCS, and at the same time we go through the general dentistry licensing exams, which includes the ORE or the LDS exam, we have a chance to register as a specialist and directly work in the UK. Okay, so this is a great opportunity for people who intend to move abroad or plan to migrate to the UK. And as I told you, there are several career prospects in the Middle East, Malaysia, Singapore, and several countries where you get better acceptance and better job opportunities. And once you clear this exam, okay, you will be elected as a dental member of the Royal College of Surgeons. So whichever Royal College exam you are giving, you'll be soon elected as a member. And once you are a member of the Royal College, you will have access to their resources, including the RCS journals, newsletters, and educational webinars. And you can also apply for travel and research grants. If you're a person who is involved in research, you have opportunities to apply for these research grants. And once you are an active member in good standing for a period of 5 years, you have an option to apply as an examiner for the RCS. Okay, you can probably travel abroad and start examining other candidates for giving this exam. So that's also a great opportunity which you get from this. And finally, the most attractive thing that we get after we clear this exam is the post-nominals. That is the M Endo RCS, M Endo RCSEd or M Endo RCS England, depending on which exam you're giving. So I hope this summarizes the most common reasons why we choose to give this exam. Now, once you have decided to give this exam, okay, the second step is to choose the Royal College. Okay, so these are the 4 Royal College which are there in UK and Ireland. There's the Royal College of Surgeons of Edinburgh, Royal College of Surgeons of England, Royal College of Physicians and Surgeons of Glasgow, and the Royal College of Surgeons of Ireland. Okay, so RCSI actually doesn't conduct a membership exam in endodontics. So they just have some fellowship exams, that too in the specialty of oral medicine and oral surgery. Okay, whereas the remaining 3 royal colleges are involved in conducting the M Endo exam. So even though there are 3 royal colleges, actually currently as of now there are just 2 exams. Okay, so there is a MEndoRCSEd exam, which is conducted by the Royal College of Surgeons of Edinburgh. And you have an M exam which is conducted by both of these Royal Colleges together. Okay, RCS England and RCPS Glasgow. So it is like a bicollegiate exam. So even if you go to the RCPS Glasgow website and when you try to click for the M exam, you will be redirected to the RCS England website for the application and for the examination process. And once you complete the exam, you have an option to either join RCS England or RCPS Glasgow as a member. Okay, so that's how this works. So this is the bicollegiate exam, which I was telling you. The examinations are quite similar, whether it is the RCS Edinburgh or the RCPS Glasgow or RCS England exam. They have exam which is conducted for all the three restorative specialties. Just like how we have an M Endo RCS, we have an Imperio RCS and Improsto RCS. So normally these three exams are conducted continuously and in the same center along with candidates from Perio and Prosto specialties. So the basic criteria for giving this exam. Okay, so I'll talk about this a little in detail in the coming slides. But you need to have a recognized bachelor's degree, and you need to have evidence of completion of your postgraduate training in whichever specialty it is, whether it is endo, perio, or prosto. Excuse me. You need to have a 3-year full-time postgraduate training. So all these three exams, whether it is M Endo, M Perio, or M Prosto, it consists of the same structure. Okay, so this I'm talking about the bicollegiate exam, which is conducted by the RCS England and RCPS Glasgow. So they have a theory component and an unseen cases component. Okay, in theory there are two papers, each of 3-hour duration, and there are multiple short answer questions. Okay, one paper would be in the candidate's chosen specialty of endodontics, and the other paper would be in general restorative dentistry. And then you have the unseen cases. Okay, unseen cases, again, you have long cases and short cases. Okay, there will be two 20-minute unseen cases in the candidate's specialty, and also there will be cases including the restorative dentistry components. Okay. Now, coming to the RCSED exam, MEndoRCSEd exam. This is the exam which myself, Dr. Sangeeta, Dr. Roshan, all three of us have given this exam. Now, the reason why we choose this exam is mainly because this is the exam which has centers outside UK. Okay, if you want to give the bicollegiate exam, or you have to visit the RCS England and you have to travel to UK to give this exam. Whereas MEndoRCSEd, they have overseas centers, including they conduct exams in Cairo, in Ajman or Dubai in UAE. Okay, so multiple centers are there depending on the time which you are applying for the exam. So you'll have to keep a watch on the website where they are going to provide all the information regarding this. Okay, so let's discuss a little more in detail about the MEndoRCSEd exam. This again has a written component. Okay, here also it's two papers. In the previous exam, it was 3-hour paper. So here it is actually 2-hour paper. So you on the first day, it is a written exam, and you'll have two hours papers, one in the morning and one in the afternoon. And there are going to be multiple short answer questions. It's not MCQs for your kind information. It's going to be short answer questions. Okay. And you will also have structured orals. So here you are, the unseen cases you are going to have would be 4 long cases and 8 short cases. Okay, so I'm not going into much detail about this because Dr. Sangeeta is going to explain this in detail, and she will take you through all the components and explain about what kind of cases would be coming for this exam. Now, regarding the exam fee, okay, till to 2023, the fee used to be around 1,500 to 1,600 pounds. But since last year, they have actually increased the fee. And currently, the fee for the UK diet is 1,800 pounds. And for any international diet, whether it is in Egypt or in UAE, it's going to be 2,200 pounds. Okay. And for this exam, there is an option to carry forward any of these components. If at all, by any chance you are not successful in any of these components, you can carry forward that. And if you're giving only the written exam in the subsequent attempt, you need to pay only 600 pounds. But if you're giving the unseen cases, then you have to pay the entire fee. Now, this is basically the main reason why we thought of doing this webinar today, because there have been some updates and some new regulations which are coming to effect from September 2026. Okay, so I'll just give you a small summary about the new updates which are going to come. So according to this new regulations which they have released, the M Endo exam is going to change and it's going to become like a fellowship exam. Okay, so instead of the M Endo RCS, it's going to become something like FDS RCS Endo. Okay, so since it becomes a fellowship exam, having a membership is always mandatory for entering the specialty exam. So you'll have to first clear MFDS before you think of giving this endo specialty exam. Okay, so there'll be a major change that is going to happen. And once you complete MFDS and once you clear the endo specialty exam, you will be awarded a fellowship after successfully passing this exam. Okay, and for existing candidates who have already cleared the M-Endo exam, or candidates who are going to give this exam this year, there will be an option to migrate directly to the fellowship. Okay, so we won't have to again go through this examination process. And another update is that the exam format is also going to be changed. Okay, so it's not very clear what the new format is going to be, but according to the informations, it's going to, in addition to unseen cases, it's going to have OSCEs and other components which would be added to the evaluation. So considering all these factors, considering these updates, we strongly feel that the best time for you to give this exam will be in 2025. Okay, so that's the reason we have come with this session today to make you all aware of this and help you in this journey. Now, the eligibility for this exam. Okay, so as I told you before, you need to have a basic dental degree, which is your bachelor's degree. You need to have a 3 years postgraduate training in the restorative specialty and in endodontics per se. And this is the basic requirement. But in addition to this, if the examination section staff are not familiar with the training or with the particular university where you have done your postgraduate training, they could ask you for some additional documents. Okay, and that includes a copy of your academic timetable, syllabus, or academic curriculum, which you can get from the university website, a copy of your training logbook or your academic logbook during the time of post-graduation, and a copy of your CV. Okay, so these are things which have been asked previously. It's not compulsory that they would ask you all these things. It depends, and it depends on how familiar they are with your dental school, and accordingly they could ask for additional information. So what I'm going to do today is I will try to take you through my journey so that you get an idea of how I started and how I confirmed my eligibility and how I applied for this exam and went on with it. Okay, so you will get a rough idea of how you will have to proceed in case you are just starting this journey. So even though I had this thought in my mind for quite a long time, I started this journey in Feb 2020. Okay, so that is when I send a mail to assess the eligibility to sit this exam. Okay, so I attach my relevant BDS, MDS degrees, and then I ask them to confirm the eligibility to sit this exam. So this is always a good thing to do. The reason is that, see, some candidates, what they have done is, when the exam is advertised in the website, they directly apply for the exam, and then they do the payment, and finally, once the Royal College asks you for certain documents, you need to really search and go around and fetch all these documents. Okay, so if you have already confirmed the eligibility, you're always on a safer side. And once you're booked the exam, you can just focus on the preparation and focus on giving this exam. Okay, so that's why I strongly recommend you all to first confirm your eligibility to sit this exam. So once I send the mail, within a week's time, I got a reply from the Royal College saying that to assess further, they need a copy of the MDS academic timetable along with the course curriculum. Okay, so for the MDS academic timetable, I downloaded the course curriculum from the Rajiv Gandhi University of Health Sciences, where I had done the post graduation, and I had sent my academic transcript along with that. Okay, so I have sent these two documents, and then I got a reply the next day that I'm pleased to inform you that you are eligible to sit this exam. Okay, so this is the first step. What I would say, if you plan to give this exam, you to first confirm your eligibility. Okay. So once you have confirmed the eligibility, the next thing is the application for this exam. Okay. So for application, as I told you before, it's done on the Royal College website. Whether it is the Edinburgh exam or the RCS England exam, you need to go to the website of the Royal College. First of all, create an account. Okay, you'll have to, if it's the first time you're logging in, you need to register with your personal details, email address, password, and create an account. Okay, so once you create an account, you can use your credentials to log into the account. And once you log in, this is how it shows. We can see your name would be mentioned here, and you could see all the exams and all other events on their website. And then you go to the exams. Okay, you click on the exams and go to the dental exams. You will see the membership in endodontics exam. Okay, you could also search for M Endo RCS directly from the website or directly from Google. But basically, you need to go to the membership in endodontics section of this website, and any exam which is available or any diet which is open for application would be advertised on the website. Okay, so currently this is the diet which they have advertised. Okay, so this is the exam which is actually scheduled in Cairo from 31st March to 3rd April. But as you can see here, it's already closed for further applications. So this is the one which is advertised currently, but there would be, according to the pattern, what we have seen, normally there would be another exam which happens in Edinburgh in September, and another one probably in November. Okay, so the November exam normally is either conducted in Dubai or in Ajman. Okay, so it was in Dubai a couple of years back, and since last year we have seen this exam in Ajman. Okay, so these are the exams which probably you can look forward to if you plan to give this exam. So now, since the exams are closed as of now, you have an option to even email to them. Once you confirm your eligibility, you can always enter the waiting list. If you're already academically and financially ready to sit this exam, you could send a mail to include them, include your name in the waiting list, so that if at all any seats are available due to some cancellations, they would inform you regarding that. So I'm just going to show you how the application process would be. So if you have an exam which is advertised on the website, okay, there would be an option to apply online. Okay, so once you see the examination details below that on the website, you will have this apply online option. Okay, Always remember, you should log in using your credentials when you're actually trying to apply for this exam. And once you apply for the exam online, you'll be taken through some personal details, confirmation regarding the exam date, when you enroll, and then once you complete your payment for the exam, you will receive an automated email with a list of documents. Okay, so there will be some checklist, some photographic form, declaration form. So all these forms would come to your email, and you need to fill all these forms and send it back to them via email. Okay, so you don't, as of now, you don't have to do any paper application and post the documents to the Royal College. You have an option to scan all the documents and just email it to them. Okay, so that makes it much easier. Now, in the application form, it was mentioned that it needs signature of your specialist in charge of training. Okay, so even in their instructions, it's also mentioned that they need certified copies of your degree certificates, which would be again attested by your specialist or supervisor in charge of your training. So I had this also as a concern, because at that point of time I was not residing in India, and and it was very difficult for me to go back to my postgraduate institute and get it signed or attested. So I'd sent a mail to them again to clarify this, and later I got a reply saying that it's not mandatory that it has to be signed by the supervisor. You can also get it attested and signed by your consultant or authorized hospital official and stamped with the official hospital stamp. Okay, so that is also an option which you have. So those of you who are not residing in your home country, you can still get it attested by the dean of the college where you're working, or by the medical director or hospital director if you're working in a hospital setup. And as I told you, you need to provide only certified copies of the documents by email or by post if you're doing a paper application. So these are the documents that are required. You need passport photographs. There's a declaration which you have to sign and send, the basic degree, and the postgraduate training. Okay, so they are not asking for any experience. Okay, so for giving this exam, you don't need to have any experience. Provided you have completed your postgraduate training, you can give this exam immediately. So the same thing I have done. I've just got my documents attested and I've just sent it across to the Royal College. And once I submitted all the relevant documents, I got an email saying that the documents have been received and I have to just wait to hear from them. And within I think within a day or something, I received another mail saying that your application has been accepted. Okay, so they've gone through all the documents and they have accepted my application for this exam. And in the same email, it's also mentioned that the examination notice or the hall ticket will be emailed to you at least 3 weeks before the examination starts. Okay, so that's how we apply for this exam. And this is a copy of the hall ticket that you are going to receive. Okay, so once so this is just taken from a Dubai exam in 2023. So you can see this exam is spread over a period of 5 days. The first day is the theory paper where you have 2 written papers of 2 hours duration, and from the second day onwards you are having your unseen cases. Okay, you have your short cases, long cases, which is spread according to the time schedule. And normally when you're giving this exam, you will be held in quarantine probably before or after the exam until other candidates are have been examined for that particular component. For any further information regarding the eligibility, the application, the blueprint for this exam, I would request you all to refer back to the website where they have a link of all the associated documents which are needed to apply or give this exam. Okay. Now I'd hand over to Dr. Sankita to take you all through the exam format and the other details regarding the examination preparation. Thank you so much.
Thank you, Dr. Nasir. So This exam format is, it has a written component and it has a structured all on clinical scenarios. So for your written exam, as Dr. Nazila already mentioned, there are 2 papers, and then you'll have a morning session and an evening session, 2-hour duration paper. And the type of the questions that are going to ask, they are multiple short answer type questions, wherein they will give you a clinical scenario. For example, they can ask you regarding some medical history or something, and then there will be 3 to 5 sub questions for a main question. So a 2-hour morning paper and evening session, and majority the topics can be endodontics, and remaining it can be restorative, prosthodontics, or periodontics. And it's not multiple. It's not an MCQ. It's a short answer question. So wherein if one question carries 1 mark, you answer 1 sentence, and if it's a 2-mark question, you write 2 points. Okay, and they have a specific mark distribution. The biggest challenge for the written component is a time management, because you can't keep on writing like essay. You'll have a limited space within your booklet in order to write the answer. So time management is the biggest challenge. Now coming to your Viva component. So in your Viva, you have 4 long cases and 8 short clinical case scenarios. So earlier we had to submit our cases, but now they will give you the cases and you just have to answer the questions that come along with it. Okay. So for each long case, the biggest advantage for a long case is that you have 15 minutes preparation time for going through the long case. So during your preparation time, they'll give you a long case in a booklet. And in this booklet, all the relevant information regarding the case will be given to you. For example, the chief complaint, the patient details, and the past dental history, medical history, and extraoral examination, coming to intraoral examination, and the investigation that they have done, maybe in the form of radiographs, clinical pictures. They can give you OPG, CBCT, etc. And they will also give you another booklet in order to write down anything specific, answers or something that you want to write. And at the end of the 15 minutes preparation time, you'll be going into the examiner's hall, and 2 examiners will be examining you or questioning you. And now for the initial half time, that is for 7.5 minutes of the initial session will be by 1 examiner, when they'll ask you regarding the long case, that is regarding the clinical pictures, interpretation of radiographs, your diagnosis, etc. And towards the second half, they will be questioning you regarding treatment planning, the prognosis of each and individual tooth, etc. So for the long, yeah, that is regarding the long case. And yeah, for short case, you will not have any preparation time. Usually you have 8 short cases. And for each short case, you will be given around 7.5 minutes. And as and when you're reading through the case, they'll be asking you questions regarding the case. Okay, so the problem with the short case is that it's like a rapid fire. As you're seeing the case, they'll be asking you questions. You'll just get a couple of seconds to go through the case. So you have 8 short cases in total. For us, it was like 4 cases all together in one session and 4 cases in another session. And for each short case, you have almost 7.5 minutes. And for 4 short cases, it's a total of 30 minutes in one session. And the cases will be alternated by 2 examiners. That is, first, all the four short cases will be in front of you in a booklet form. And you'll take the first booklet, and then the first examiner will question you. And then the second case will be asked by the second examiner. And similarly, it will be alternated between both the examiners. So how will the examiners judge you? So before going into a specialist level of understanding the subject, one thing that they want us to be is to be a safe general dentist. So without understanding the basics and without knowing the simple things and cases, and without that going into advanced level of endodontics and talking about that is not what they expect, because they want us to identify the simple things and basic things first. Okay, so multidisciplinary evidence-based approach towards treatment planning, your communication skills, your time management, and also your confidence level will be assessed. how the distribution of marking and happens. So each case will be double marked and each examiner will mark independently. For each case, candidate will be marked based on 2 or more following skills domains for the structured oral examination on clinical scenarios. So these are the domains in which your examiner is going to assess you. So one can be interpretation of your clinical materials and special tests. Second, diagnosis, then prognosis, treatment planning, maintenance, and recall. So for every case, there is a maximum of 5 marks that is available for each of the skill domains, which is most appropriate for the case. A candidate must achieve at least a score of 3 across all the domains and cases to pass that section of the examination. For example, for long case, out of those 5 domains, they will be taking at least 4 domains, which is appropriate for that case. So for one long case, if diagnosis is more important, it could be prognosis, treatment planning, and recall, which is more important, rather than interpreting the clinical and radiograph. So they'll take that 4 domains. It will depend upon what type of case it is. And regarding the short case, they will take 2 most appropriate domains out of the 5 domains that is applicable to case. So this has already been discussed. You can either clear the written and carry over the Viva component or vice versa. And candidates must achieve a pass in the written component as an average score of 3 out of 5 for each domain in the structured oral component to clear the examination. So this is a blueprint of membership in endodontics for this examination. So the general restorative element, yeah. So basically, they'll check whether you are a safe dentist and first, only then they'll be assessing your specialist level of knowledge. Okay. So you can take a screenshot of this. It's regarding the syllabus and the topics are usually questioned in this exam. So coming to Acer Royal College exam. So we are happy to introduce to you all that we are conducting a course. We have been conducting it for the past 2 years. Dr. Roshan was our first student who cleared this examination. And last year, we had 2 other candidates who cleared in the Ajman exam. Unfortunately, they're not here with us to share their feedback. So our course includes a 3 months intensive training and yeah, all the lectures and cases are focused on previously asked questions. Right from the time we started preparing, we have a collection of all the questions and previously asked Viva points, cases, everything. And what you get for this training is that, so you'll have a weekly Zoom meeting or Zoom sessions. You'll have 2 lectures a week. Like that, you'll have it for almost 12 weeks, which is 3 months. And individually, we will also be taking Vivas for you. And you'll have almost 14 long cases and then short case discussions also will be there. So for each Viva, you'll have 1 long case and 2 short cases discussion. Individually, we'll be discussing with you. We'll be taking Vivas, and then right after the Vivas, we'll be sharing feedbacks with you regarding how you have performed. And also we'll be sharing all the articles and previous questions. Then yeah, the guidelines, the latest guidelines, everything will be given to you. And so our next batch is going to start this 28th of February. So we welcome you all for a great learning experience. Thank you. So if you have any questions, you can unmute and ask.
Yeah, there is a comment. When will the dates for the application open for the next diet approximately? So normally it would be open quite well in advance. Like if it's for the September and November exam, which is probably the next exams which will be advertised, you could expect it around like May or June. Okay. But what we would advise is don't wait for the exam to be advertised and then start preparing. Okay. So in the UK system or in the Western system, what they are seeing is when you are actually when you're applying for an exam, you should be financially and academically ready to sit for the exam. Okay, so it's not that you book the exam and then you start preparing. So I think this is one thing which we didn't mention in this webinar. You need to have at least on an average 4 to 6 months of preparation to give this exam. Okay, so in that way, what I would say is this is the right time for all of you to start and prepare for this exam. And as and when the exam is advertised on the website, you could go ahead and book the exam. Dr. Sana is asking, do we need to clear IELTS for this exam? We don't need, IELTS is not a requirement. So whatever I have mentioned is just the eligibility for this exam. You don't need any other documents. RCS England, yeah, they also offer the same exam. I have told you. RCS England and RCPS Glasgow, they have a bicollegiate exam, which is conducted by the RCS England. The exam is currently, if you see the website, they have advertised an exam which you have an option to give the written part online. Okay, the entire exam is not online, only the written part is online, and for the unseen cases you will have to go to London and give it there. I hope that is clear, Dr. Said. Provisional degrees would be accepted, provided it will be certified by the dean of the institution where you have done the post-graduation. And you are not going to get any information regarding the waiting list. Okay, so it's just given you a suggestion in case you are ready to sit the exam and you're just waiting for a diet. You could just email and ask them. But normally they will prioritize based on how many people have contacted them. So, but you can never ask them how many people are already there on the waiting list. Okay, so what we would advise you is, if you're ready to sit this exam, as and when it is advertised on the website, you should go ahead and book the exam. Okay, so the more you delay, there will be a greater chance of you missing that particular diet. As I told you, experience is not mandatory for this exam. So they are not asking for any experience. And if you submit experience certificate, it's not going to give you any extra benefit. Dr. Tina Susan, that's what I had clarified. The new regulations and the new updates are going to be effective from 2026. Okay, so this year, 2025, the exam pattern, application guidelines are everything according to what we have just mentioned. Okay, so new pattern would come into effect from next year. Certified copy of the documents means that it will be a copy of your documents, which would be, it is just like an attested document, which would be certified as a true copy by your postgraduate supervisor or by the hospital official or by the dean of the institution where you are currently working. The format of the logbook. Okay, so a logbook is not a mandatory requirement. I was not asked to submit the logbook, but there are candidates who have been asked. So what this can be, they don't have any regular any prescribed format which they have mentioned. So this could be your postgraduate logbook, which contains details of all the cases, and if you have made something like a portfolio, you could even submit that as this requirement. So Sangeeta, did we miss any questions in this?
No, I think we're all covered. We've covered everything.
If anybody would like to unmute and talk, you're free to do that now.
Hello.
Yeah, hello.
Can you
Hello,
hear
doctor.
me?
Yes,
Yeah.
you're on.
I am Dr. Srinath Thakur. I am quite a senior person in the field of dentistry. I was principal of SDM Dental College, Dharwad. I'm sure you might have heard of that for
Sure.
Yes,
long
doctor.
15 long years. And
sir.
now I attended your webinar only because my son has completed his MDS in Cons Endo, and I
Okay.
want him
Sir.
to do this exam, Mendo exam.
Sure,
So
sir.
it was a, first of all, I would like to appreciate Sangeeta as well as yourself for the excellent talk. Made it very simple and lot of things which many people probably would have had doubts in their mind, it would have been cleared. Because I was
Yes.
in UK, I've done my FDS RCS and I've taken my MRD exam also. So
That's nice.
I have been an experienced person being in UK. But first of all, let me congratulate you for running this course and having a good name and guiding people who want to pursue this exam. Because here back home in India, what happens is it's very less information people give. Who have passed also, they won't share much about their knowledge about the exam, which I
Exactly.
feel you have done excellent and given maximum information in a very simple way.
Thank you so
So
much.
Thank you so much, sir.
congratulations, and hopefully my son takes up this exam in the next diet, and we'll see of him joining the course and all that. Thank
All the best to
you.
him.
Thank
All the
you
best, sir.
both, Nasil and
Thank you, sir.
Sangeeta.
Thank you.
Wish you all the very best for your future. And any help, you can contact me, Sanjay Thakur,
Sure, sir.
father, Srinath Thakur. Thank
Sure,
you.
Okay,
sir.
sir. Thank you so much, sir.
When we started this journey, we didn't have any idea about. We are totally clueless about
In
this
fact, we were misguided also in a way, right? So we all want you
That's
to have the correct guidance before attempting this exam, because without a proper guidance, you can go wrong in many things in this exam. If you have a right guidance, it's the best exam to clear in the first attempt. So Dr. Roshan is an example for it. In spite of his busy schedule, work schedule, and like family commitments, he always found time to read and put his effort and hard work in all our vivas, and also, so he's a living example for all that. So yeah.
Hi, doctors. Actually, I want to thank Dr. Nasil and Dr. Sankita for their uh, immense commitment and dedication towards their students. So I was only successful because of their commitment and dedication. I would tell my effort is always there, but I should really appreciate your efforts and your support throughout my journey. So anytime I had any queries or any confusions regarding preparation, they were there with me. So I just messaged them. They will directly call me, and they made sure that each of my doubt and everything which I needed to know regarding this preparation was cleared. So I am very much thankful for your commitment and dedication towards your students, and I would highly recommend your guidance and training for the people who really wish to take the exam with a serious mind. So all I have to tell to the aspirants is we need to put in some effort, but the effort should be with a proper guidance. The guidance will be properly given, delivered by Dr. Nasil and Dr. Sangeeta for your preparations. So I would highly recommend them for any of your queries regarding this course. I wish all the best for everybody. Thank you.
Thank
Thank
you,
you so
doctor.
much. Do we have any other queries or anything to be clarified? I think if there is nothing to be discussed, we could wind up this session for today. Thank you all for attending this webinar and being a part of this session. I hope you all found it useful, and if you need any further information, feel free to contact us on our email. Thank you so much for attending, and good night to all.